you, Kathy. Right, I've just heard the recording message. Hello, everyone. It's lovely to see so many people wanting to hear about Frimley Clinical Commissioning Group and last year. This is my first AGM as the Chief Executive of Frimley CCG. However, I have worked with partners in Frimley for 20 odd years, certainly in the Northeast Hampshire and Farnham and Surrey Heath part of the system. And I've lived in the East Berkshire part of the Frimley system for well over 20 years. So I feel absolutely at home with the partners and as a member of the community. However, last year, we had a huge amount of work progressed by the 3 clinical commissioning groups, which now form the merged clinical commissioning group. And that was under the heading of the Frimley Collaborative. And also last year, we had the huge challenge that many of you, all of you have experienced actually, which has been meeting the challenge of a global pandemic, and as well as trying to organise ourselves for the future. And what I'm going to do is share a little bit about the progress from last year, and there will be an opportunity later on to talk about plans to go forward as well. But this section, I'm going to concentrate on giving you the kind of statutory report of the Clinical Commissioning Group Collaborative for Frimley for last year, which does mean there are 3 sets of accounts to talk about, which adds a bit of complexity, certainly for me, as I wasn't the accountable officer of those organisations at the time, but I'll do my best to share the progress that's been made. So throughout last year, we, as I say, worked with all the partners across the Frimley patch to respond in the best way possible to the global pandemic. And from the primary care side of the system, we did manage to maintain access to services throughout the year, albeit in different ways through use of technology and online approaches. But through the huge and hard work of everyone, those of us in the community that live in the patch, as well as professionals that work across health and social care, we've managed to work well and transform a range of services through the pandemic through last year. We also are facing, as many of you will be aware of, because I know I can see there's lots of friends and acquaintances in the audience with us today, we also have managed to recover in part, but we still have quite significant waits across the National Health Service across the country, but also within the Frimley system. But comparatively, the Frimley Clinical Commissioning Group area is doing really well compared to other parts, but it still means we do have the challenge of addressing a backlog of waits because of the huge amount of work that's had to be done to ensure good and effective infection protection control across all our services, and also to be able to respond to the pandemic and administer vaccines. But we'll hear more about that through the presentations today. So a little bit more about the collaborative. Next slide, please. So as I said, we've spent the last year moving from being a collaborative to being a merged clinical commissioning group. And this gives you a flavour of our 5 localities: Bracknell Forest, Northeast Hampshire and Farnham, Royal Borough of Windsor and Maidenhead, Slough and Surrey Heath. And all the 3, so we had 3 clinical commissioning groups for those 5 localities. So there was East Berkshire, North East Hampshire and Farnham, and Surrey Heath. All of those clinical commissioning groups achieved a rating of and a judgment of being outstanding by NHS England. And it's an example of the strength of high achievement, not only in the clinical commissioning group, but with partners in the Frimley patch. So I became the chief executive or accountable officer of the clinical commissioning group after it had formally merged on the 1st of April. And I just want to say a massive thank you to the clinical commissioning group staff and the members of the collaborative who really worked whilst the huge response to the pandemic was being managed to deliver that merger. And it's complicated. A three-way merger of three organisations requires an awful lot of detail and administration, and also producing three sets of accounts has been particularly challenging. So my thanks to the team that did all of that. I came in after it had been done, and it's incredibly impressive what the clinical commissioning group team managed to achieve in delivering that. And we're now drawing together. So my appointment coincided with really starting to build the new NHS. I call it about redesigning the National Health Service for the 21st century, with moving towards building integrated care systems with partners. So where the National Health Service kind of reinvents, but in the context of being a nationally mandated service to work with local public sector and voluntary sector partners to the best effect for our communities. And I'll talk about that later on in a separate section towards the end of this session. So some of our achievements and challenges, is that the next slide I need to look at? Yes. So as I've said, and I'm emphasising, all of us, and I know some of you that are in the audience live and work in neighbouring patches, and we've all been engaged in a year, last 18 months. We've never experienced anything like it. And I just want to highlight some of the standout achievements and projects that the clinical commissioning groups under the collaborative achieved last year. So the first area would be around our focus on developing the general practice estate. And we have set up and established a number of projects to improve and design fit for purpose estate in Britwell, Slough, in Heatherwood, in Ascot, and in the Farnborough Centre for Health, just to name some of those projects. We've also, as part of and in support of the integrated care system strategy, we really mobilised as a clinical commissioning group a number of community engagement projects, such as the Royal Borough of Windsor and Maidenhead Together programme and the One Slough programme. We've been, as a set of clinical commissioning groups, critical partners in those community engagement projects. We've further rolled out and developed the approach to innovation funding, which started and learned from North East Hampshire and Farnham and the success there, and we'll hear more about that later in the presentations. And we've managed to enhance our integrated care offer through the pandemic into care homes across the Frimley system. And we've also improved adult community services in Surrey Heath and North East Hampshire and Farnham. We've particularly managed to focus with our focus around health inequalities, on support to homeless people in Slough, and a number of responses to asylum seekers as they've joined our communities, particularly in Slough. So collaboration has been the name of the game through last year and last 18 months. And that's collaboration between people, neighbourhoods, communities, health and care, and our voluntary sector partners. And we really want to keep on building that sense of Frimley as a team of people, community, residents, and public service and voluntary sector working together to enable people to live well. So my last few slides are doing the formal bit on the money, I think. It's the next one, yes. So this slide just gives you an indicator of the additional investment that has been put our way to support both COVID funding, primary care infrastructure, and acute capacity. We've also seen a growth in funding for mental health service as part of the long-term plan, and also in response to the pandemic. And we've continued to maintain our partnership funding through the Better Care Fund approach, with 49 million across the collaborative continued to be invested. And then our performance, the next slide, please. Financially, it's worth saying that all three of the separate CCG clinical commissioning groups have achieved their statutory responsibilities financially, with East Berkshire breaking even. And this gives you a breakdown of how that money is apportioned and spent, with the big blue bit being acute services. And then you'll see the orange bit is mental health, and the yellow bit is primary care, with community services in grey, just to give you an idea of the breakdown. Next slide, please. North East Hampshire and Farnham achieved a break-even position financially, and there you can see a slightly different proportion in terms of acute investment, slightly lower than as a proportion of the total, but a slightly higher investment per head of population in North East Hampshire and Farnham. And then the last slide, which is about Surrey Heath, who achieved a surplus of 1.7 million at the end of last year. And you'll see again a similar kind of breakdown and apportionment of resources. And as we move forward, part of our strategy, both as a clinical commissioning group, but as we move to developing the integrated care system for Frimley, will be to have a financial strategy that is framed by addressing health inequalities across the geography of the system, as well as within the 5 localities. So, and the goal is to see and be really clear about evidencing the growth of investment in mental health and community that is coming through, as well as developing effective recovery to address waiting lists for the rest of this year, and addressed increased demand across primary care and into our hospital sectors. So I'll stop there. That's me, Kathy. I've probably overrun, but
brilliant. Oh, thanks, Fiona. That's a lot to get through. 3 sets of accounts is no mean feat. Thank you so much. So I'm going to ask Dr. Hugh Thomas, who's our chair, GP and Maidenhead, to talk us through some of the specifics around the pandemic and the vaccination. Hugh.
Thank you, Kathy. Good afternoon, everyone. So over the last 18 months, we've seen an unprecedented change to the way we work in the National Health Service. And we've really been proud of all our staff and communities in the way that they've responded. Rapid changes have taken place to meet social distancing requirements and to respond to the infection prevention and control to keep everybody safe. We know we've had to change the way that people access health services, but we have been able to maintain many general practice and hospital services during this time. We're now working towards building our future models of care and ensuring we engage with people to recognise where those changes really do work and make things easier, and also recognise where things don't work so well for everyone. So talking about general practice, next slide, please. Every part of the NHS is reporting significantly increased levels of demand, and general practice is certainly no exception, with increased requests for consultations of all types. Demand levels are currently higher than usual in the winter, and this is at a time when staff have already worked through the second wave of the pandemic and are in the vaccination program and just embarking on the booster program. There are backlogs of routine care for people with long-term conditions, and waiting lists for hospital appointments and routine surgery are also impacting on general practice. It's likely to take many months before waiting times for routine treatments start to reduce. Our staff are all working hard to keep everyone safe and well and ensure that those who need a face-to-face appointment are able to get one. There are a wide range of options available to you when seeking support, and this includes telephone and online consultations, the NHS app, 111 online and over the phone, and your local pharmacy. Over the past year, general practice has undergone considerable adjustment in our response to COVID-19. A key component of the approach is offering an alternative to face-to-face consultations, enabling access to services without having to take time out to visit a surgery. Virtual appointments can offer many benefits. You can be seen from home, make seeing a doctor or professional less daunting, and you can fit it around family and working life. We know that virtual appointments suit some people more than others, but many conditions can be safely assessed and treated over the phone or online. They can also be used effectively to triage patients who need face-to-face appointments to make sure that their conditions are managed safely. People often interchange GP general practitioner and GP general practice, and we want to ensure people know that in general practice, there are a variety of people who are best placed to help you for particular things. There's a broad mix of staff working in general practice, including physician associates, paramedic practitioners, clinical pharmacists, nurse practitioners, just to name a few. And they've all been given the right training to ensure that they can help with a range of issues. Next slide, please. We know it can sometimes be confusing to know how to access services or where the best place to seek the help you need is. We've created a Know Where to Go When Feeling Unwell poster, which is shown on the screen at the moment, to help. We'll share it with you after the meeting today, so please do take the time to find out more about it and all the options available to you. We also ask that people be prepared to talk to your GP reception team so that they can direct you to the right member of the team first time. Please do consider alternative medicine methods of seeking advice if they're suitable or if they're offered to you. Your GP or staff at the emergency department in the hospitals are not always the people who can help you the best or the fastest. Next slide, please. We've listened to feedback from local people and produced a guide to help you to stay well. These will be distributed across the patch at flu clinics and by our partners. We'll share this again with you after the meeting and hope you find it helpful. It covers mental health, self-care, carers information, and much more. We also have a new website, Frimley Healthier Together, which has comprehensive advice on how to care for children and young people, and offers a clear traffic light system to know when you can care for them at home and if and when you may need extra support. Next slide, please. A huge part of our work this year has been to deliver the COVID vaccination programme. Over 1 million vaccinations have been given across the Frimley ICS. 91.4% of people in cohorts 1 to 9 have been vaccinated. That's those aged over 50 and those aged over 18 who are clinically vulnerable. 81.5% of people in cohort 10, that's ages 40 to 49 years old, were also vaccinated. And we're proud to be at the top of the country for vaccinating 16 to 17-year-olds. The vaccine program has been delivered from local vaccination centres. There are 12 of those across the area, a community pharmacy and a vaccination centre in Slough. We've also had pop-up clinics in central locations, which have coincided with popular events, and they've been aiming to reach people less able to get to or likely to attend for a vaccination at a vaccination centre. Next slide, please. We've been helping people to make informed choices about having the vaccine, and this was a crucial part of the work. We knew that people had questions, and so we offered dedicated sessions for community and religious leaders, as well as health and social care staff, to ask questions about COVID-19 vaccinations. During the summer, staff attended local community events to answer vaccine-related questions and online events. We scheduled sessions via Facebook and Twitter and encouraged people to talk about vaccines, ask questions, and we had the right people responding to those queries. We've got lots of resources and video content available on our websites, which responds to the insight we gathered about people's worries and concerns. And we continue to update a dedicated vaccine web page on the ICS website, frimleyhealthandcare.org.uk, which includes a session to help protect people from vaccine fraud and sharing details of things to be alert for. Next slide, please. We don't want to leave anyone behind, and we've been using data to understand the uptake across the area and ensure we've got service provision in the right places. We have a mobile vaccination offer for those who can't come to a vaccination site. The Frimley ICS vaccination page has information about all the walk-in vaccination opportunities across the entire patch, and this information is updated on a regular basis. The services adapted their opening hours to meet the need, with evening and weekend opening and encouraging people to bring a friend. Next slide, please. We knew we needed to role model positive behaviours to help people realise the importance of being vaccinated, and that other people like me are taking up the vaccination opportunity. All partners shared the communication materials, and for each phase, we used real case studies to tell the story of why people were choosing to get vaccinated. It was fantastic to see so many local people stepping forward to be included as part of this campaign and to share their stories. Next slide, please. All of our vaccination sites have done incredibly well to vaccinate the local populations. The outstanding vaccination efforts at the Yateley site were acknowledged by His Royal Highness Prince William on a phone call and then a Zoom call with the then Secretary of State. Some of our areas have huge disparities in terms of health inequalities and really had to go the extra mile to ensure that everyone had confidence in the vaccine programme. You can see the tuk-tuk here that was used to spread the message. We also wanted to make sure that our residents with serious mental health illnesses would also take up the offer, and additional processes were put in place to support these groups too. We wouldn't have been able to deliver any of this without our amazing volunteers and partners, and we want to say a really huge thank you to them all again here today. We had lots of others who wanted to see the effects of local people and thank those involved. In January, Ross Kemp, the celebrity, visited the Salt Hill Vaccination Centre in Slough. He met the volunteers and gave them a special thank you, which then featured on the Lorraine Show and in the Sun newspaper. Theresa May visited the site in Maidenhead to thank everyone involved there. His Royal Highness the Earl of Wessex paid a special visit to the Royal Windsor Racecourse, and that was in May, and thanked volunteers and staff for their outstanding efforts. And everyone, of course, was delighted when Brian Blessed came to get his vaccination in Surrey Heath. As we all know, the response to the pandemic is not over yet, unfortunately. And so we encourage you all of those eligible, to come forward when you're called for your booster COVID vaccination and to consider taking the offer of flu jab if you're eligible as well. We must all please still be vigilant and maintain our good practices around washing hands, wearing face coverings when appropriate, and keeping up to date with the latest guidance. Thank you, Kathy. I'll hand over.
Thanks, Hugh. That's great. It's lovely to see all of those kind of successful pictures and recognition nationally for the vaccination programme. And thank you again to all of our volunteers. And if anyone hasn't seen it, I think Donna Bone from Rushmore Voluntary Services is on the call. They've done a fantastic video, the sing along to the Monkeys song, sort of celebrating the vaccine effort there. So that's really worth a look. Okay, we're going to move on now to look at some of the data and insight work that's going on at the moment in Frimley. And I'm delighted to invite Jane Hogg, who's Director of Transformation for Frimley Integrated Care System. If you hear the ICS term, that's what it stands for, Integrated Care System. And Dr. Amandeep Dosanjh, who's a GP in Maidenhead, and she's also the Clinical Director for the Maidenhead Primary Care Network. So over to you, Jane.
Thanks very much, Kathy, and the eagle-eyed amongst you will have spotted my hair's changed since the photograph was taken, but I am Jane. I am the Transformation Director for the Integrated Care System, and I'm going to take you through the next part of this and then hand over to Amandeep, who can tell you about some of the more specific examples. So as you've heard from Fiona Edwards, our Frimley Health and Care Integrated Care System is made up of health and care partners who've agreed to work together. We've got a fantastic range of different communities across our 800,000 population. We do have fantastic results for many of our residents because we have people who live in significant health and well-being. We also have people who have significant deprivation or experience health inequalities. And what we're trying to do is reduce that difference in healthy life expectancy over the next period by working together around a range of strategic priorities. Next slide, thanks. So what we're really trying to do is understand the difference between all of the elements that we're trying to do together. So how do we really understand what impact COVID has had on you, your health, how you're experiencing health and care and looking after yourselves at the moment, listening to the views and experiences of many people across our population to help us to do that. We're trying to use this to understand insights to really make a difference in how people are accessing those different services, whether they're getting what they need by doing them, and whether we need to think about doing things differently with you or for you as part of making significant progress. We match this up to what people tell us about their health and care through all the different ways that we engage. And you'll hear a little bit more about some of that community work as we go on through the AGM today. And then we can also help it to really understand where there are those gaps in care. So if we helped people to access services more quickly, if we provided that greater integration across all those different partners, whether it's around housing, around education, and also all of those different health and care providers, whether that could have prevented some ill health or helped better outcomes when people experience that ill health. So we think by working together, by really understanding those insights in our plans and actions, we could significantly change how we deliver care going forward. Given that we know that there's greater need in some parts of our population, and some of that is geographically located, and some of it is spread amongst different groups, we could then make different choices about how we prioritize access to care and the types of care that we offer. So we wanted to explore that with you a little bit more and show you how we're using that data to help us make those choices. So next slide, thanks.
Across Frimley Health and Care, your local health and care services are working closely together to provide safe, efficient and timely care, using all the resources we have to ensure we meet your needs and provide you with the right care at the right time. We're working together to make sure that information about you, such as long-term conditions, medicines and allergies, is available if you become unwell to paramedics and hospital staff, social care, care home and mental health professionals. Your health and care information can tell us a lot of important information that can help us better plan your care or help us to help you to look after yourself. We use patient information to plan how we can help people to prevent or manage ill health. For example, using data to tell us who is at risk of diabetes and providing early intervention support on diet, exercise and information on the risks and symptoms to look for. We're able to put together information to help health and care professionals make the best decisions about your care. For example, we can identify those who have tested positive for COVID-19 and would benefit from being enrolled onto a COVID oximetry at home service. This enables fast referral to a service that provides remote monitoring with a pulse oximeter, a small device that clips on your finger to measure heart rate and oxygen levels, to help identify signs of low oxygen levels and deterioration earlier. We're also looking at how we use information about how people are using health services, alongside what local people tell us, to help shape how we design our services, to ensure they're fit for the future and meet the needs of our local communities. An example of this is using information on take-up of vaccinations to target specific communities, to tailor our communications and how and where to access vaccination clinics. We've also been using what you tell us through the many ways we engage with you to help us understand what local communities want, need and dislike. This helps us shape how we communicate with you and share our messages. We want to ensure we provide the best possible services based on what we already know and what you tell us, creating healthier communities together. We know that listening to local people and communities brings a different perspective to our understanding and can challenge our view of how we think services are received and should be delivered in the future. To join the conversation, please visit www.frimleyhealthandcare.org.uk/get-involved.
Thanks very much for that. So hopefully that's brought that to life for you, and to bring it to life a bit more, I'm going to hand over to Amandeep, and she's going to tell you a couple of real examples of how we've used that data in the recent.
Thank you, Jane. I'm Amanda Sanj. I'm a GP in Maidenhead and I'm Clinical Director of Maidenhead PCN, and that's the group of practices across Maidenhead who work in collaboration together. So at the beginning of the pandemic, we knew that we had enhanced infection control procedures and it would take longer to see each patient. So although we were seeing our patients, it was taking us much longer and we were creating a backlog. This was really bad for the patient and for our practices. We also knew that staff were a limited resource and many of our staff were also getting sick from COVID. We knew that patients were scared and anxious about coming to see us, and we could see from our data that those who were most in need were accessing services the least, and we had to really think about what we prioritise and how we did it. Our data was showing us that diabetics were much more at risk from COVID, but also at risk if we didn't continue doing their care. Next slide, please. So what did we do about it? We worked with other providers. So these are people like our out of hours service, the Berkshire Health Foundation Trust, to redeploy and retrain staff. This meant that we could maintain high activity levels of seeing our patients in general practice, and also meant that we could use our nurses and specialist primary care staff, like doctors, to do things that only they were qualified to do, like childhood immunisations and smears. This meant we were able to actually maintain our level of service, but actually in the case of Maidenhead, we improved and we did more childhood immunisations than we have done previously, coming above the 90% target. We were able to maintain the number of smears we were doing above the 80% target. We also created a cardiac lifestyle check at the vaccination site, trying to maximise what we could do where we were seeing patients. All of these things together enabled both practices, GP staff, and patients to handle the pressure of what was a really difficult winter. Next slide, please. Was that the end? Not quite. Going through the pandemic and using the diabetic service the way we did showed us that patients had increased in obesity. There were more raised blood pressures and raised sugars due to the lifestyle changes that had happened during the pandemic. Therefore, we've worked with our community partners in the voluntary sector and social services to try and address some of these issues. The new data is also starting to show us that there are some health inequalities within Maidenhead, and we have a working group on this that works with the local communities. We can generate ideas of how we can solve these problems together, and this is forming the kind of route for future work. Some of the things that have come from this has been looking at our bowel cancer screening rates, and if you go to the Maidenhead Vaccination Centre, there's some enhanced help for your bowel cancer screening. We've also started to see a link between mental health and the social isolation during the pandemic, and a new piece of work is starting on this. We've really started to look at health inequalities in our local community. Next slide. So the pulse oximetry piece of work led by Dr. Iyer is a great example where, like in the video that we've just seen, data can be pulled and patients can access a service that maintains their health without having to be referred by a GP in the traditional way. And this has been excellent for patients and their health. Next slide, please. There have been lots of ways that our analytics team have helped us to use insight and target services and information. This means that we can keep people healthier. These are just some of the examples that have happened locally. And that's all from me, Kathy.
Thanks, Amandeep. That was great. Really good to get some practical examples of, if we're looking for positive outcomes, if you like, of COVID, and let's face it, there aren't many of those, are there? But maybe one of them is the fact that it's really encouraged quick innovation and collaboration across organisations that perhaps hadn't worked together quite so well in the past. So I think that theme of collaboration and the fact that really healthcare isn't just something that the NHS does, I think long gone are those days, aren't they? It's something that we can all get involved in. So thank you very much to Jane and Amandeep for that. We're going to move on now just to look at a different side to the work of the Clinical Commissioning Group, and that's really around how we all work together, we as residents and patients and punters, as well as our colleagues across health care, local authorities and the voluntary sector. There's a lot on this slide, sorry, and the type is quite small, but you will be able to look at these slides after today because we're going to put them all up on the website. And I just wanted to pull out a couple of parts of this slide just to illustrate our approach. So at the very top, the top hexagon says community deal in it, and that's really underpinning the way that we're going to be building on how we've always tried to work together with local residents, to try and make sure that we make the best of all the strengths and the services that we already have in our local area. So that really underpins, that's really an approach that we are going to continue to build as this, as the Frimley CCG continues and as we develop the structures of the NHS into the future. So the other bit that I wanted to, I suppose maybe a couple of things just to mention about community deal is, I think really that we want to encourage innovation and to really recognise the fact that we know so many of the solutions, if you like, to some of the health and care issues that we are thinking about at the moment lie within local communities, and that people are very good at coming up with their own solutions and their own ideas, and that we need to find ways to try and really make the most of those great ideas and those strengths that we've got within the communities. The next example I wanted to pick up on the next slide is one particular one which I know several of you will be familiar with, and that's the Innovation Fund. And this was an idea that was generated by one of our local volunteers in 2017. I think it was the first time we ran the Innovation Fund, and it began in North East Hants and Farnham and is now spread across the Frimley geography, which is fantastic. It really does build on what I mentioned a moment ago, which is really inviting local communities, local people to help us think about what are the best ways to address the health and care needs that exist within different parts of the community. And the Innovation Fund this year has spread, and it has been much larger and definitely been much broader in terms of the agencies and organisations involved, which is fantastic. So I think we've had to do it all online, which has certainly lost a little bit of the buzz that we used to get in the room when we talked about all of the project ideas that people were coming up with. But again, hopefully that's only a temporary change. And so far this year, right across the Frimley geography, we've funded 34 projects, have been allocated some funding, and I think it's something around £150,000. So it's really grown in terms of the geographical spread, the sorts of projects that we're able to support, and that can only be a good thing. And I think what we've got in the next little piece is a video which will show you some examples of some of the ideas and the projects that the Innovation Fund has been able to support. It's a reasonably long video. I think it's about 10 minutes. So please don't go anywhere because it's really great to see some of these ideas that local people have come up with really come to life. So I hope you enjoy it.
The community deal is very much a key ambition within the Frimley Integrated Care System strategy. It's very much an enabler. The individual people in individual communities have a much better understanding of what works for them and their communities than probably we do as organisations.
This ongoing dialogue between ourselves and those we serve, and you have to give help and support to people in a way that they feel they can access, that they can use. We don't have all the answers, and very often our communities do.
We're standing on the site of what will be our new community garden in Fleet.
I think people have had a lot of restrictions placed on them in the last 18 months, lost control over their lives a bit, and I think this is going to really build people's resilience back up and keep them fit and healthy and happy and make new friends.
We're really bringing together a whole variety of people from across our district where they can share their experiences, they can socialise, you know, they really get an opportunity to get out, and that's so important for community spirit, health and well-being, socialising. It's really important to us that we create a place that people value and love and want to come out and use.
In my role, our main aim is to build partnerships to ensure that places like the Hart Green Garden can be established. It requires a lot of partnership working, collaborative working, and I'm delighted to see that that collaborative working has brought together everybody, and in the next couple of months we'll be able to start bringing it to life.
Working alongside Men's Shed particularly, they have been so supportive. They've built us some really great things for the site, saved us lots of money.
It was just natural, just felt right that when they told us about the community garden, was there anything we could do to help, that we said yes, of course.
At the end of the day, the community is key to everything, and for the NHS to recognise that is a real bonus.
Support from the NHS in helping to establish community gardens, men's sheds, and enabling us to run and provide that support is just so important.
So we started out looking at things that we could do, and what we started out first with was delivering food parcels to people who were social isolating or who were shielding. So we looked around for what we could do and talked to the local allotment society, and they provided us with a pile of food.
We had a few people turn up, a few, and then the following Sunday, just a few more. Then word got round where people got what it was, and sure enough, before long, it was very well used, and it's become a huge part of our community. And we're addressing all sorts of needs. So we are addressing mental health needs, and we're addressing physical needs too.
So we're now supporting something like 60 families each week. There was a lady who came up to us about a week ago who was back in work for the first time in a year, but she's actually got her old job back, in fact a slightly better version of her job, but you know, she's a single mum, and her statement was very simple, that it helped her keep her family together and allowed them to survive the pandemic.
The fact that the NHS can be stuck in at a local level and see the needs and help existing projects, I think is a beautiful thing.
When the pandemic started, a lot of the services, they moved online, or a lot of the support groups that was run locally, they moved online. And so our elderly Nepali people, they were struggling to, let's say, book appointment with the GPs or accessing any of the support system that is available.
So it's sort of like reducing the social isolation, but also it's like digitally making them competent, you know, giving that sort of skills.
Many of these people live in a HMO as well, housing in multiple occupations, and pre-pandemic they used to come out in the park like this and mingle with other people. When they were by themselves in those rooms, they had no phone, they had no television. That obviously really impacted their mental well-being as well.
We have been delivering online sessions via Zoom. We do sessions once in a week.
There is a gap between the community and the service provider, and I think projects like us, projects that are led by people who are in the community, helps to bridge that gap.
Because you guys have given us this funding, you guys have really encouraged us to do more in the community, and we are able to connect with lots of young people and other organizations, and that has given us lots of confidence.
We have seen what is the demand and what needs to be done, so when you listen to us, then we get more done, we get to help more people. I think that's the one message.
The idea was that I knew that we had a lot of rich culture in our community, and I wanted to make sure that everybody was aware of it. And by sharing culture, we're then promoting education and encouraging everybody to appreciate all of the rich culture that we have in our community, because there's so much in Bracknell which we still don't know about, and everyone should be open to learning more about them.
So I've just been at an online cultural event this afternoon in Bracknell, where we've had a number of people from our local community talking about their rich experiences of culture, coming from different levels and backgrounds, talking about various things like food recipes, and also some of the engaging projects that they've done for charity in and around the community and also different parts of the world.
This project is to help to improve the local residents' and patients' health well-being, and by demonstrations, cooking techniques, different talks, different informative ideas from the communities to share with all Bracknell Forest residents or patients.
One thing that I would say to local healthcare services is always be open to learning about new cultures, and always be open to developing on the current practices that you have.
We wanted to make sure that we could do everything that we could to make sure that the most vulnerable people within the community were supported. And so with discussions with partners, including the Frimley Health Trust and the local authority, we came up with the idea of looking to see if we could pilot the Wellbeing Project.
The Wellbeing Circle project is about building a network around a patient to enable them to be independent, enable them to go out to socialise, which has a positive impact on their health and well-being.
You've got this resident who needs something, and then we find a way to meet that need.
A number of the people that we've supported, for example, have just not had access to the internet, have not had access to computers. And so we've been able to reach out to our network to be able to find people to go in to support individuals, to set up laptops, to set up the internet within their house, so that they then suddenly have the ability to be able to access online shopping, for example, and therefore get shopping deliveries.
There's so much opportunity out there that if we don't engage our voluntary care organisations, within the integrated care world that already includes health and social care. We're just missing a huge opportunity, both for them, for us, and for, most importantly, for the residents.
It's about sustainability, it is about driving forward, and I can only see it growing.
The partnerships have been absolutely amazing and extremely strong. So we're here at Salt Hill Activity Centre, which has been converted into a vaccination site. And we've developed various different methods of working with our volunteers and our volunteers working with the public.
So I work from home, so I wasn't actually getting out to see anybody or getting to go anywhere or having stuff. So I thought it would be a good opportunity to actually get out of the house. But also I wanted to be able to do something for the community.
It's our little roles that are making the big impact in the long run. From everything we've gone through in the last 8 months, it wouldn't have worked smoothly without the youth organisations and the community groups.
The One Slough Champions started around November. Volunteers and residents were allowed to sign up to become a community champion. We hold fortnightly sessions, which gives champions latest information from public health, messaging that is important to get out into the community.
When you work with local organisations that care about their towns, you will always get a good result, and you will always get the buy-in of local people. People who know their own town, know their neighbours, and know exactly the way that we can communicate with each other and work together.
Seeing the work that both individual residents and communities are doing is really absolutely awe-inspiring, and it's what keeps me going.
The one message I would give to communities is you can and you are able, and we are listening, and we can support you, sometimes with funding, to achieve your visions and your ambition. So come on board, work with us, the door is open, and we want to hear what you have to say.
Thank you, Jim O'Donnell. I think you're on the call. I think you pretty well summed that up at the very end there. That was fantastic. Thank you so much. And I loved that film. A couple of things struck me just before we move on to the portal. I think if there was ever kind of some examples of value for money, then that's it. You know, we know that some of these projects, they don't cost a lot, much cheaper than delivering care in a hospital setting, and incredibly sort of amazing results with just a bit of support. And the other thing that really struck me was that they really build on the strengths and the expertise that already exists within our communities. So we know that statutory bodies are not very good at sort of engaging directly with residents, but actually all of these organisations and community groups and experts, I think one of our contributors said people who know their own town, they're the experts. And I think it's brilliant that the NHS is now making, you know, so much better linkages and relationships with those experts. The other thing that struck me really was that so much of this stuff around health and care is not actually about health care or medicines. It's all around social relationships, the value of volunteering, skilling, getting new skills, the environment, having good food, and all of those different issues that have such a big effect on our own well-being. So thank you for making that film for us. So the last bit I just wanted to pick up was a new way that we are building to help residents and local people to have a conversation with health and care providers, so that we can hear what you think and what you want, and we can also test out some ideas with you. So this is a new portal that's just being developed. It's only one way that we want to keep that conversation going. We know that lots of people don't particularly like to contribute on websites and the internet, and that's absolutely fine. We will still always value those face-to-face opportunities and a whole range of different ways to talk to you. But this is just one new thing that we're trying, and it's a place really where we're going to start to put out information, but also use it as a place to test ideas, put some surveys up there, see what you think. There's opportunities to sign up, for example, for the community panel. You can do that online there. So we'll build this over time and use it as a bit of a resource space. I think there's a live survey at the moment around GP access, so please do go and have a look if you'd like to contribute to that, and we'll grow it over time and as different resources and different projects come on stream. So it's just one new way that we're trying to help kind of make sure we've got lots of different ways for residents to influence the care that they're able to access. So that's all I wanted to say in terms of our sort of community engagement work. And then I think I'm going to hand back to Fiona to take us on a bit of a look ahead for the last part of the presentation. So over to you, Fiona.
Thank you, Kathy. So, our system, this is about the movement through, as I referenced earlier, to redesign the National Health Service and therefore move from a more fragmented set of arrangements to embedding the kind of collaboration and community orientation that we've just seen in that fabulous video. So to date, I've been the integrated care system lead for a couple of years now, and prior to that I've been on the board since it was established as a chief exec of one of Surrey and Borders up until April this year. So our journey has meant that we developed our strategy just before the pandemic hit us to really focus on tackling health inequalities and being really clear that our collective work, that is our partners across local authority, health, voluntary sector, should be focused on reducing the difference in life expectancy from one part of our system to another part, and improving the quality of life, hence the focus on our relationship with communities, people and neighbours. And collaboration underpins everything for us. And we've deeply invested in building a network of relationships, both as leaders and increasingly in all parts of our system. And where we want to move to is the kind of beautiful examples we've got where we really value and demonstrably invest through things like the Innovation Fund in the strength of community leaders and community partners in the voluntary sector to really help us support people and residents to live healthy lives. So that strategy was articulated. This is our Frimley Rainbow, I call it, which breaks down into starting well and a real focus on improving the support response and the conditions for children and young people to thrive. And we've just had an integrated care system board this morning where we've agreed to prioritise investment in additional leadership for children and young people for this particular ambition, because we're quite fragmented across our system in being able to pull together, not least because of the complexity of multiple local authority arrangements. And so increasingly we will be playing into our local authority partners and then drawing the strands together to ensure we're playing a strong part with Hampshire County Council, Surrey County Council, the 3 unitaries in East Berkshire, Royal Borough of Windsor and Maidenhead, Slough and Bracknell Forest, and then all our district and boroughs as well, Surrey Heath, Hart, Rushmore, Waverley. And we will be moving to having a different level of dialogue with all those different types of local authority partners as we develop the integrated care system moving forward. So we're about addressing health inequalities. We're recognised in the country as the best performing integrated care system, and the only integrated care system in the country that sits in that kind of top range sector 1 of the oversight framework. And that is because, it's not because we've got a wonderful set of committees and architect and bureaucracy. It is the quality of relationships that we've built. Many of us have known each other for years. We trust each other, and we trust our public service ethos to really do the best for our communities. And so when we, at the moment, are facing a massive surge in demand, so when we worry about access to primary care, we know that the level of demand is higher than it's ever been pre-pandemic. It isn't that GPs have closed their doors or shut themselves away. We have a massive surge in demand, particularly amongst younger people going on. And we've also got a massive surge of presentations in our emergency department. It would be really tempting to say it's this part of the system's fault. We're not responding, somebody's closed their doors. That's not what's going on, but we have to really build our relationships. So we really take a team Frimley approach. So that underpins our journey as we move forward to the integrated care system. And I think I've got one more slide, which looks at the components, and really it's just trying to stress that moving forward now, we had a big debate about whether Frimley integrated care system would carry on, because we are complicated in that we have multiple relationships with multiple local authority partners, for example, and partly because we're the highest performing integrated care system in the country, it was felt that we would carry on, not least to help the development of other integrated care systems and to build and share some of the fantastic practice that we've got. But going forward, we also have a design architecture being developed nationally, which will potentially propose a bit of a risk for the effectiveness of our working, because we have been a voluntary partnership to date, whereas now we're going to be setting up an integrated care board and a statutory body, which is an NHS statutory body. And the risk of that is that all the local authority partners that I've just mentioned to you are at risk of feeling excluded from being equal partners because it is an NHS body. So we're going to have to crack that, and we're going to launch an engagement piece of work and a number of meetings with local authority partners, voluntary sector partners, as well as health partners, and anyone that wants to join the conversation, to coin the clinical commissioning group's phrase, over the coming months, so that we can develop an integrated care partnership, which is the partnership board at the top of that, which really then the integrated care board can be held to account by. So so we really build on that coalition of the willing of the integrated care system to be much broader and deeper now. Our districts and boroughs haven't been at the top table, if you like, and so the opportunity will arise as we design the integrated care partnership arrangements for Frimley. So we do have a bit of bureaucratic design work to do, but we're going to do that through conversation and connecting. And we also have to support each other to deal with very real pressures and demands of the pandemic, the vaccination programme, facing into winter pressures, and the backlog of waiting times. So we've got a big job going ahead, but we're in the best position to be able to respond well to our communities and residents. So, and I'll stop there.
Fantastic, thank you, Fiona. That's great. We are running on time, which is good news. I know that I've got a little note from one of my colleagues to say some people have struggled to get into the meeting. So apologies if you tried but weren't able to get in and therefore joined a little bit late. But don't worry, because we are recording it and we will certainly make that available afterwards, so you can have a look at the bits if you missed any. We've also been collecting some questions that have come into the chat. And I've got a number of illustrious colleagues who are lined up to address some of those questions. So I think Fiona's going to be available. Rob Morgan, who's our Chief Finance Officer, Hugh Thomas, our Chair, Jane Hogg, who you heard earlier, Director of Transformation, and also Sarah Ballas, who's our Director of Quality and Nursing and the lead for Infection Prevention and Control. So there's a few people that can address some of those questions. Just to head off a couple, we are going to send, I think, an email with all of the links, all of the resources and all of the slides. Sounds like a huge email to me, to everybody who wanted to come along today. So don't worry if you didn't take notes as we were going along. So that will come to you, and it'll also have additional resources and links so you can find all the other stuff that we've referred to throughout the presentation. So that sounds like a bumper one coming. And just another one I thought I'd pick up before I start fielding questions to my colleagues. Valerie, I think you mentioned community associations across areas as are just as important, and I absolutely take that on board. The voluntary and community sector is a diverse and varied beast, not even a single beast, with lots of formal structures and lots of less formal structures, and we probably have to work a little bit harder to talk to and hear from those less formal structures. So I absolutely take that on as a challenge to us going forward. I think there are a couple more questions. I'm going to do my double screening here, so excuse me if I look away at my other screen where I've got my questions. So I've got one here around digital appointments with GPs. I might direct this at Hugh if I could. So the question is, how do we make the new digital functions complementary to GP face-to-face appointments and not instead of? So too many are not offering appointments. So Hugh, I wonder if you want to have a crack at that one.
Thanks, Kathy. So we want technology to support general practice appointments, not be instead of. For lots of people, technology works really well, whether it's e-consultations or using telephone or using video. But absolutely, face-to-face appointments are really important, and we're encouraging all our practices to offer them. They have been offering them all the way through the pandemic, but they will be doing telephone triage to make sure that people are safe before they're seen. Because sometimes doors are closed, the practices are still working behind the scenes and should be opening the doors for patients when they're coming for face-to-face appointments. So it's disappointing to hear if that's your experience. It's certainly not in every practice, and we are strongly encouraging practices to be opening their front doors.
Sorry, double clicked on my mute button. Thanks a lot, Hugh. So the next question is, how long before improved life expectancy data will be available for the digital projects, or will we be putting resources in without measuring outcomes? Jane, do you want to have a go, or maybe Amandeep, if she's still on the call at that one?
So I think Jane will have had to have gone to another meeting, and Amandeep had to go back to practice and see people.
Fair enough.
So I'll answer it. I mean, that is the core of the strategy. We have an umbrella measurable outcome developed from our strategy, which was to reduce the gap in life expectancy between the worst health outcome part of our system and the best by 3 years. So that is a very clear measurable outcome, and all the analytic capability that we're building will be there to track it. And we're also using it in a more granular, detailed way around different condition groups as well. So absolutely, that's at the heart of the strategy and where we want to be. And we are already in a leading position, and we need to now accelerate that over the next 2 years.
Thank you, Fiona. While you're on the screen, can I keep you here for the next question, which is, the Innovation Fund came about due to an open door of a previous Chief Executive for North East Hampshire and Farnham. And will Fiona still have that open door to the public in the same way?
Well, Maggie and I are great friends, so we have a lot of similarities and a lot of differences. And so from my point of view, absolutely, we need to build, I think one of the joys of this medium is it can create a virtual open door. And so therefore, as we move forward over the next few months, I would be very keen to have some help with co-designing the whole approach for all of us to be accessible and available. So that's my commitment. Yeah.
Thanks, and you're recorded on here saying it, so there we go. Thank you, Fiona, that's very helpful. I've got one more question here, which is, what can we do to get better consistency across our GP practices? Hugh, do you want to have an attempt at that one?
So you may or may not know that GP practices are independent contractors, so they have to follow the NHS contract, which they do. What I think I'd like to put across is that we've been in a pandemic for 18 months. It's hugely affected the working lives of everyone in primary care and patients, and they're trying to keep people safe. If they judge that they have to keep their doors shut for periods of time and continue to do telephone triage first, then that's normally put in for a reason, and that's to keep you safe. In the early days, when the doors are open, before we really hit the pandemic, lots and lots of people were coming into primary care with COVID symptoms, along with everyone who were trying to manage on a daily basis with their ongoing chronic diseases. So it all come from safety. There's no hiding behind doors. People haven't worked harder in primary care over the last few months, and I'd really encourage you to get behind your practices and support them, rather than lots and lots of the criticism that's coming at the moment within the press and these campaigns. Understand it from their point of view. We're trying to work with our local PPGs and patient groups to understand things from your point of view, but equally, please let's work together to all be doing the same thing.
Thanks, Hugh. I think we hear that message, and we hear the passion that you bring to that, and I know to your role as a GP as well. And just along those lines, there's a question here that just popped up in the chat around staff and frontline staff and receptionists experiencing increasing abuse, and how are you able to support them and help them to get through that?
Shall I pick that one up? Hello, Councillor Muir. Good to see you. And I know it came from you, that question. So I'm really glad you asked that question, because we talked about this very issue at our public governing body meeting last week, and that so just to be clear, there's a very real risk, and it's happening, of staff just leaving because the level of stress and difficulty they're encountering in particularly reception staff in GP surgeries, but also in emergency departments. Our ambulance service, 53% of employees in the ambulance service suffer abuse every single day as a result of helping people. Now, I know people are incredibly stressed when they need help, and sometimes desperate. So I think one of the ways to help is to acknowledge this, and to have a conversation with the public and residents and with everyone here about how can we be compassionate together with each other in dealing with the pressure and the strain of a pandemic, but also the consequences of a backlog in waits and a different way of accessing. So I think one thing that helps our staff is to be open and talk about it, and to talk with each other. We do offer, we've got a comprehensive range of health and wellbeing offers for our staff, and staff in the clinical commissioning group do have access to me directly with an open door to raise any concerns as well, so that we can hear about it as it happens, but also we're trying to campaign and help at a national level as well, with how do we talk to the public about this in a way that doesn't tell them off, because people are genuinely anxious and distressed when they need help. So I think it's an area where we can respond and acknowledge and support our staff, but also we need a bit of a public conversation when feelings are running high, with the whole offer that we're building for the public and residents to recover services as well. So that it's a number of approaches, but I'm one of the critical things is that people such as yourself, Councillor Muir, speak up about it, because it's so helpful that you're acknowledging it. So thank you.
Thank you, Fiona. Really important point there. I can't see any more questions in the chat, so I think we may give ourselves a couple of minutes break before going on to something else, if you've got something else booked for 3 o'clock. But just before we do, I just want to say a huge thank you to my communications engagement team colleagues who've put all of the meeting together, and it all just works so seamlessly. It's like magic. I don't know how they do it. The slides pop up and the people come and go, and the microphone works and the chat's there. So thank you very much to all of the team for putting this together. It's really a great achievement, and with so many people on the call as well. And as I said, hopefully next time we get together, we'll be in person. We can have a little bit of a chit chat, perhaps a slightly ropey sandwich, and it'll all feel like a little bit more normal. But we really, really do appreciate you all giving us your time this afternoon. I know it's not the most appealing thing to be staring at a computer screen for an hour and a half. So I do hope that you found it interesting and useful, and please do keep sending us your questions. Have a look at the portal, come along to things when they're face to face. Just please do keep talking to us, because it's so important. And as I said, there'll be an email coming after today with all of the bumps that you've seen and lots of other resources. So please do share that far and wide. I don't think anything is proprietary in there. We're very happy for you to pass that on and encourage others to use it as well. So thank you very much, everybody. Enjoy the rest of your day, and I hope to see some of you in real time, in real face-to-face before too long. But take care until then. Thanks, everyone. Bye.